Thank you all so much for being here today and giving us a little moment to talk about today's vote. I want to start off by expressing my appreciation to the San Diego City Council for their strong vote this morning to ratify a vaccine mandate for our city employees. I also want to thank our city's Chief Operating Officer, Jake Goldstone, for his hard work on this matter, as well as Christina Peralta, Tim Davis, and the members of the city's Human Resources and Personnel Department. This has been a team effort to work with our bargaining units, work with our employees to bring this item before the City Council and get it passed again on a strong vote this morning. You know, many of you know I'm a student of history. I studied history at the University of San Diego, and I think history is important, particularly if we pay attention to it. And my appreciation for the City Council today is extremely deep, because I refer you to the 1918 influenza pandemic that hit our city. At that time, the city was facing a number of infections, rising death levels. We had about 20 people who were counted as having died of the influenza virus in October of 1918. The City Council at that time was asked to implement a number of safety measures to try and address that pandemic. The City Council did not vote to ratify that request. 2 months later, when 370 San Diegans had passed of the influenza virus, the council did take action. This council has learned the mistakes of the past. They are students of history. They understand the times we find ourselves in, and they understand that bold action is necessary to get out of this pandemic. And let me be clear, vaccines are the way out of this pandemic. So, to the public who may have questions about this, I want you to understand that while we are still working to anticipate the operational impacts of today's decision, what we know is that there have been operational impacts to date. Those of you that watched the testimony this morning, I shared the number of missed trash collections, the 2 police academies that were suspended, the fire academy that was suspended, the number of times that we've had to have operational changes to our fire rescue response because we had over 30 firefighters quarantining at a particular time. The list goes on and on. We are being impacted today, and that's why this action was so very necessary. And so I want San Diegans to be able to interact with its city workforce with confidence, that when you call 911, you understand that the individual who's responding to your call will have been vaccinated against COVID-19. I want the employee that responds to that call also to be able to enter into that home or that business with the confidence of knowing that they are protected against the virus. That's what today's vote is about. That as people collect garbage and clean sidewalks in the city, they can do it confidently. That when you need to go to a library or to a rec center, you understand that you can do that with greater confidence. And I think it's extremely important that our employees be able to do that with confidence as well. We have a couple of the council members who'd like to make some comments, and I invite them to come forward. But I want to answer the question maybe some of you might be asking. And I want to be very clear. I don't want to lose any member of our city family. I don't hope that none of them choose to leave city service. But more importantly, I don't want to lose any of them to COVID-19. And sadly, to date, we've lost a few. So I hope that those who have yet to take the virus will choose to take, I hope that those who have yet to take the vaccine will choose to do so. I hope that they'll do it for their health, the health of their loved ones, for their coworkers. I hope they'll do it for their city. With that, it gives me pleasure to introduce our City Council President, Dr. Jennifer Campbell. Council President.
Thank you. Thanks, Chris. That's too short. Yeah, that's why we have that. Thank you. Thank you. Take this off to speak. Thank you so much, and thank you to my council colleagues for supporting today's votes. It's very important that we follow data, that we follow science, that we follow facts. The role of government is to protect the public. That's one of our many roles, but one of our most important roles is to protect the public from things such as health crises. And that's what this is. You know, in 1 year, we have had over 4,000 deaths in this county from COVID, whereas in 5 years, we've only had 400 deaths approximately from influenza. 5 years versus 1 year, 100 times more. So you can see that this virus is so extremely deadly, extremely virulent. I too was a history major before I changed and went into science, biology, and then on to medical school. And so knowing the history of medicine, we've had vaccines since the 1700s when Dr. Jenner brought forth the smallpox vaccine. And so we know that they work, and we know that this one works. It is no longer experimental. It is completely approved by the FDA. And furthermore, it has been taken by millions and millions and millions of people around the globe safely. And you can ask the mayor if it hurt when he got his. And I had the pleasure of helping some people get their vaccines by giving them their vaccines. And I'm delighted to do that because it prevents illness. And prevention is the mainstay of keeping the public healthy. That's why we have a sewer system. That's why we have a clean water system. That's why we're fighting climate change. We're trying to keep the air clean. Public health is very, very important. It's number one in our job as representatives of the public. And so I am grateful, and I hope that everyone who works for our city will get their vaccine so that they can be protected, so that they can remain in employment with us. We love our city workers, and we want them all to be safe and to have their jobs. So thank you so much. Stephen, can I introduce you?
I'm good. Thank you.
They know who you are.
Thank you very much, Dr. Campbell. Thank you, Mayor. My name is Stephen Whitburn. I represent Council District 3 on the City Council. It is in the best interest of taxpayers and residents to have city workers who are less likely to get sick and miss work and less likely to spread COVID-19 to others. It is our responsibility to ensure that our workforce is vaccinated, and I applaud the mayor's leadership in protecting our health. This could mean that we lose some valuable city employees. We have terrific city employees, and they have every right to make their own decisions about whether to get the vaccine and whether to continue working for the city. I hope that they do. Not only do we have a talented workforce, we need our city employees now more than ever. We are short-staffed as it is. We need to be hiring employees, not losing them. And I hope that our city employees who are not vaccinated and who perhaps opposed the action that we took today, nonetheless understand that they are valued and appreciated, and hopefully they will decide to go ahead, even if reluctantly, and continue their proud service with the city of San Diego. Thank you, and I am pleased to introduce Councilmember Montgomery Steppe, who represents District 4.
Hello, take this off. Hope everyone is doing well. I just came to stand in solidarity with the mayor and my council colleagues who supported citywide, or for our city employees, mandatory vaccination today. I also just want to speak as a District 4 representative who houses many city employees in my district that I appreciate every single city employee, whether they have chosen to get vaccinated or not. I want to make that clear. However, I think what we did today is in the best interest of all of our employees and our residents. And you know, we have an institution of public health for a reason. I think we demonstrated that today as a council and as a city. And I also just want to briefly point out that there are reasonable accommodations attached to this for medical and religious purposes. I do believe that this mandate will withstand any sort of challenges, and that is why I supported it. You know, there are many different opinions on this issue, but I think we have to keep the main thing the main thing. And at the end of the day, we want to keep our residents and our employees safe, and that is in fact, public safety is in fact our number one duty as elected officials for the city of San Diego. And so the vaccine is effective, it's safe. We want to continue to do the right thing for the city. That's why I'm here, just stop by to say a few words. And I also appreciate the mayor and your leadership back in August on this, my council colleagues for a very thoughtful discussion today, I thought. And we have to continue to press on so that we can have a safe and healthy San Diego. When we talk to our tourism industry folks, one of the main things that they say to people who want to come to San Diego is that we have 81% of folks fully vaccinated in our region. And so we have to remember that there are many, many things at stake as we make this decision. And I think we're all confident that we're moving forward together in the right direction. So thank you very much. And at this time, Councilmember von Wilpert.
Thank you. Good afternoon. My name is Marni von Wilpert. I am the council member for City Council District 5. I want to thank our mayor, Todd Gloria, and his team in his office, and Jay Goldstone, for their work on this important policy step we took today to institute a vaccine requirement for continued employment to keep everyone in our city safe, including our city employees. As I said on the dais earlier today, I am very proud of all of our 11,000 plus employees, incredibly proud of the work our San Diego police officers do every day to put their lives on the line to keep our citizens safe. But part of keeping our citizens safe is preventing a transmissible disease. And that's why we're asking people to get vaccinated. You know, many of us sat around our Thanksgiving tables just this last weekend for the first time in a year, because we have a vaccine. Think about where we were last Thanksgiving. We had people, our ICU beds were full, our restaurants were closed, our unemployment rate was through the roof. We couldn't be in the same room with our elderly parents or folks who had pre-existing conditions. We sat outside wearing masks, socially distanced from one another. Our convention center last year was an emergency shelter for people living on the streets. This year, it housed the Comic-Con resurgence because of vaccines. This year, we were able to sit across from our loved ones sharing a Thanksgiving meal because of vaccines. This year, our restaurants were open, our workers were employed because of vaccines. So I'm grateful for the mayor's leadership, for my colleagues' leadership. I'm very proud to be a native San Diegan today more than ever. So thank you. And now I will introduce, we skipped Councilmember LaCava from D1.
I'm not going to speak.
Never mind. Okay. Anyone else? Okay.
I would note that council members LaCava and Elo Rivera are probably the most popular, because no one ever said, I wish that speech went on longer. No one ever said the press conference was too short. Am I right? Even the journalists would agree with that. But I appreciate these council members being present. It's important to the general public that they understand how committed the leadership of the city is to their safety, to their health, and that we're taking actions to actually effectuate that. I thank the council members for their comments, and I neglected to reference the city attorney's office, who's also been very actively involved in this conversation over many months. I also want to thank our represented employee groups who also were at the table having these conversations. Not an easy process. I understand and I respect that. But we were able to come to some agreement with some folks, not necessarily agreement with others, but what we are is moving forward. And that's where I want to end. You know, as the mayor of this city, I think sometimes I'm given the honor of being able to try and channel what it is our city is feeling. And what I think is that we are tired of this pandemic. We are tired of the burdens associated with it. And we all want to move on. This council and I want to focus 100% of our time on homelessness, on housing affordability, on infrastructure repair, the kinds of issues that we're making progress on, but we admit that we have to spend a lot of time on the pandemic. As I said before, I'll say it again, the way out of this pandemic is through vaccines. With today's action, we are a step closer to doing precisely that. I ask San Diegans, if you have not yet gotten vaccinated, please do so. If you need to get boosted, do that as well. I did mine a week ago. I recommend it. But probably more importantly, and I hope that you all will help me out when you tell this story, to the 80+% of San Diegans who have done this already, they know it's safe, they know it's effective, they know it's easy to get, and they know that it brings a peace of mind that we were hoping for only a year ago, as Councilmember von Wilpert mentioned. Let's not focus on the small minority who reference things that are not based in fact or in science, who are holding us in the grips of this pandemic for longer than any of us thought we need to do. It's time to move on. It's time to let majority rule. And it's time to get back to the business of running this city. So thank you to every city employee All 11,000 of them. They're incredible public servants. Again, 80% of them have gotten vaccinated. I ask the remaining 20%, please do this for yourself, for your loved ones, for your coworkers. Do this for your city. Let's get vaccinated. Let's put COVID-19 behind all of us. With that, I'm happy to answer anyone's questions, along with the council members. Carlos.
Can you please have for the common people, what is the difference between mandatory vaccine, the mandate, and the ordinance? Especially because people say, but we thought that it was already done, mandatory vaccine, but the ordinance, what is the difference?
So the ordinance the council approved this morning applies to city employees. So those who have employment with the city of San Diego, all of our bargaining units, our classified and unclassified employees are all now expected to get a COVID-19 vaccine by December the 1st. To your point about the general public, there's not a mandate for the general public to get vaccinated. But again, 80+% of San Diegans have done so. What we're hoping to do is to make sure that our employees are protected, that the public that interacts with our employees are protected, and that we can put this pandemic behind us sooner rather than later.
One of the questions from some of the folks outside that we had a moment to chat with is, why was this the only option? Why wasn't testing an option or other opportunities to keep these folks working with the city?
I don't know if Jay wants to maybe answer that, but I will remind that there, as Councilmember Montgomery Steppe mentioned, there are reasonable accommodations for religious and medical purposes. But Jay, do you want to speak to that a bit?
Sure.
Thank you, sir.
Talk about how many of those have been submitted and how many of those are going to be granted?
To your first question, we did look at testing as an option, but it has to be provided on the city's time, and the city has to pay for any testing. And we felt, first of all, you may test negative today, and then it might be another week before you're tested again. But during that time, you could catch it. So we decided it was a better interest of the public and our workforce to have everybody have to be actually vaccinated. In terms of the numbers, right now we're at about 619 as of this morning who have submitted either religious or medical accommodation requests. We're still in the process of reviewing. We haven't notified any of the employees whether or not they're approved or denied yet, and we'll do that probably sometime later this week.
I'm sorry, that includes all the employees, including police and firefighters.
Right. Of roughly the 2,000 employees who have yet to be vaccinated, we have about 619, most of which are religious accommodation requests. We have about 15 or so of those that are medical requests.
Do you have contingency plans for next week? Let's say 100 police officers don't show up to work next week. What is the city going to do?
Well, first of all, this doesn't take absolute effect next week. I mean, as of Wednesday, we have the mandatory vaccination requirements, but they have 30 days basically to cure. So we'll give them an option letter, which will give them some options, and they have until January 3rd to actually be then fully vaccinated. And then even after that, they'll have the opportunity to appeal any decisions. They'll get a notice, an advance notice of termination, and they have the right to appeal it. We are putting contingency plans into place. Obviously some of it's going to be overtime. Some of it will be, we try to beef up the recruitment process, maybe offer incentives for people to come to work for the city that are fully vaccinated. But we also recognize that there could be some hopefully short-term service implications with this. Hopefully more so in the non-public safety areas, but even in the public safety areas, if we were to lose a vast number of police officers, we'll have to reprioritize the calls that they go on in the short term, and then try to beef up some of the academies that will take place.
And I appreciate just to maybe underline a little bit. I've seen more than a few headlines suggesting that December 1st is the date. If you or your organization reported that, you got it wrong. As Jay mentioned, it is effective the 1st, but through the progressive disciplinary process, the functional date would be sometime in 2022. But we now have clarity and certainty for employees about what the expectation is. It's been set. I believe that most employees will meet that expectation, and I thank them for that. We may lose some folks. As I said before, I hope we don't lose anybody. But the operational impacts that Jay was talking about are potential. What I know are the operational impacts that are happening now. And your viewers have seen it. When the garbage didn't get picked up, when some other things have happened in the city, that's happening today and now. I believe today's action will help reduce that. Anyone else? Guys, thank you for being here. Thanks for helping us share this information. And thank you again to the members of the City Council and our city team. Let's move forward. Let's get back to the business of running the city. Let's pave some streets. Let's house some homeless people, okay? Happy holidays, everybody.